One of the things that you'll be doing all year long is physical exams. To start with, we need to go over some terminology that you can use when you identify a problem to let us know exactly where that problem is. The first pair of terms is anterior and posterior. Anterior refers to where the head is. Posterior would be the opposite of that. So in this picture, this would be the anterior end. This would be the posterior end. So this dog has a gray spot anterior to the big blotch on his belly. The next pair is dorsal and ventral. Dorsal, like the dorsal fin of a shark or a dolphin, is the back. Ventral would then be the stomach. Distal and proximal have to be used in relation to another body part. So if you look at this joint right here, these two spots are distal to this joint. That means they're farther away from the body than this joint. So this spot right here is proximal to this joint. It is closer to the body than this joint right here. So that's another way you can describe the location. Medial and lateral refer to the center line and anything that is not the center line. So in most vertebrates, the center line, which would be the back, where the backbone is, where the spine is, that is the medial plane, and it runs all the way from the dorsal end to the ventral end. So that's the medial plane. Anywhere else along the body would be a lateral plane. So if you were to go just, instead of right on the medial plane, if you were to go right here and go across the body here, this would be a lateral plane. And again, it would go from the top to the bottom, but on the side of the animal, not in the middle. The pelvic region is where the back legs meet the body. So this is the pelvic region. The pectoral region then is where the front legs meet the body, and so it would be this area right here. When you're doing physical exams, it's best if you do the exam in the same order every single time. And the best place to start is at the head. The head includes the mouth, the nose, the eyes, and the ears. And if you do it in this order, you'll be starting in the front on the bottom and moving up and towards the back. So when you're done with the head, you're ready to do the next part. If you do it in the same order every time, you'll never forget where you are or what the next thing is. So we'll start with the mouth. Gums in the mouth should be pink, not red, and the teeth should be white. The only exception there are some of the rodents, not all of them, but some of the rodents will actually have yellow, even an orangish color teeth, and that's normal for them, but it would not be normal for any other animal. When you look in their mouth, their gums or other parts of their mouths may have brown or black pigment, kind of like freckles or spots, and that's normal. Now, if you notice that the spot is changing or it's not nice and smooth like the rest of the skin, then you may want to have someone look at it just to make sure that it is actually normal and what their mouths usually look like. Next would be the nose. The nose is abnormal if there's any kind of discharge, and that would be runny discharge or old discharge that's nice and crusty. If there's frequent sneezing, that would be abnormal. Now, if you've just put pine shavings in a container and the animal sneezes once, it's probably just the dust. But if they continue to sneeze, then there may be something wrong. And then any cuts or bumps on the nose would also be abnormal. After the nose comes the eyes. For the eyes is where you'll start using tools. We have pin lights, which are small flashlights about the size of a pen, thus the name. And you can use those to help you observe the eyes. Now, you're not actually looking into the eye. What you're using it for is to look at the surface of the eye, particularly to look for scratches or to look if the eye is reactive. And that means the pupil, that black part of your eye, when you shine the light on it, the pupil should get smaller. And then when you take the light away, it should get bigger. You don't want to shine the light for long periods of time in the animal's eyes because that will hurt them, just like if someone were to shine a bright light into your eyes. But if you flick it across their eyes, you should be able to see their pupils reacting, and then you'll also be able to see any scratches that are actually on the eyeball. Other abnormal things, any crust or discharge, just like around the nose. If it's around the eyes, that would be a problem. If the eye is red or the area around the eye is red, that would be abnormal. If the pupil, that black part, is gray or white, they could have a cataract. And what that means is the lens that is behind the pupil becomes cloudy. So instead of being like nice clear glass, it's foggy. And that means the animal may not be able to see as well. Sometimes you'll see this in older animals. And then also any bumps or growths would be an abnormality for their eyes. Ears have wax for a reason, and that's to help it collect the dust in the air before it actually gets to the eardrum. So some wax is okay, but if there's a lot of dirt in the ear or if there's a lot of wax buildup, we will need to clean it out, and that would be abnormal. Any cuts or bumps again around the ear would be a problem, and we're going to start using something other than our eyes and actually smell for an odor. Ears should not smell bad. If they do, there is probably an infection and we need to deal with that. So use your nose, sniff the ear, make sure it's okay. If there is dirt or too much wax present, we do clean out the ears. We have cotton swabs. We can use peroxide, but we also have an odic solution, which odic means ear. So we can clean out the animal's ears. And that is one of your competencies that you'll need to do sometime during this year. If you're cleaning ears, you probably will need someone else to help you hold them. Most of our animals don't like it when you clean their ears.